Module Overview. As caregivers, health workers, first responders, teachers, case managers, and support personnel serve trauma-affected individuals and communities, they often bear silent emotional burdens. This burden, known as vicarious trauma, is not the result of personal trauma, but the empathic exposure to the trauma of others, accumulated over time. When left unaddressed, vicarious trauma can evolve into burnout, compassion fatigue, psychological exhaustion, and even post-traumatic stress symptoms, impacting performance, mental well-being, relationships, and organizational culture. This module provides a deep, multidisciplinary analysis of vicarious trauma, compassion fatigue, and burnout in trauma-facing roles. It arms you with essential strategies for self-awareness, regulation, reflective practice, and organizational advocacy. The goal is to normalize self-care, prevent emotional depletion, and ensure service providers can continue offering safe, ethical, and trauma-informed care without sacrificing their own well-being. Understanding vicarious trauma. Definition. Vicarious trauma, VT, is the transformation of a helper's inner experience through empathetic engagement with others' trauma stories. It is not weakness, but a neurological and emotional consequence of sustained exposure to suffering, pain, grief, and crisis. Compassion. Fatigue. This refers to the gradual lessening of compassion due to overexposure to distress. The provider may feel emotionally numb or disinterested. Burnout. Burnout is a chronic state of physical and emotional exhaustion, often caused by overwhelming workload, lack of support, or unresolved stress. Secondary traumatic stress, STS. STS involves trauma-like symptoms, e.g. nightmares, hypervigilance, triggered by hearing trauma disclosures, especially in therapists, nurses, and shelter workers. Signs and symptoms. Emotional symptoms, chronic sadness or irritability, feelings of hopelessness or guilt, emotional numbness, low motivation or disinterest. Cognitive symptoms, difficulty concentrating, intrusive thoughts about clients, cynicism and detachment, negative self-image. Physical symptoms, fatigue and sleep disturbances, frequent headaches or illness, appetite changes, muscle tension. Behavioral symptoms, social withdrawal, decreased productivity, avoidance of certain clients, alcohol or substance use. Red flag. When a caregiver starts identifying too closely with a client's trauma or feels overwhelmed after sessions, VT may be present. Protective factors and resilience. What helps? Strong personal boundaries, emotional self-awareness, regular debriefing and supervision, physical self-care, nutrition, sleep, exercise, community and peer support, meaning-making, understanding your role and purpose, humor and creative expression. Personal self-care strategies, daily rituals, morning meditation, gratitude journaling, or mindful tea breaks to anchor your energy. Body awareness, recognizing physical tension and releasing it through stretching or breathing. Emotional regulation techniques, grounding exercises, progressive muscle relaxation. EFT tapping, mindfulness-based stress reduction, MBSR, recreational balance. Spend time on hobbies, nature walks, music, or spiritual practices outside work. Digital boundaries, avoid checking work emails or trauma-related content outside work hours. Saying no when to decline extra tasks to preserve energy and balance. Organizational responsibility in preventing vicarious trauma. A trauma-informed workplace. Should normalize discussions about stress and trauma, provide regular reflective supervision, allow mental health days, create a culture of peer support, monitor staff workloads, and rotate high-intensity duties. Avoid rewarding martyr culture, glorifying overwork. Workplace tools, Vicarious Trauma Toolkit, VTT. staff satisfaction surveys, mandatory wellness check-ins, anonymous feedback systems. Legal, ethical, and accreditation standards. Maintaining the mental health of trauma-facing staff is not just best practice, it's a duty of care. Failing to support workers can lead to legal risk, service failure, or regulatory penalties. Standards referenced. 1. Accreditation, Body 2. Relevant guidelines, SAM-HSA, USA. Organizations must integrate trauma awareness across all levels, including staff wellness. World Health Organization, WHO. Mental health of caregivers is critical in humanitarian settings. Joint Commission. Burnout and fatigue are recognized as safety concerns requiring leadership response. Occupational health and safety agencies. Psychological injury is covered under worker protection laws in many jurisdictions. National councils for behavioral health organizations should include trauma stewardship and VT prevention in training. Developing a self-care and VT prevention plan. Step 1. Self-assessment use tools like the Professional Quality of Life, ProQOL, scale to identify your risk levels. Step 2. Goal setting. Set realistic wellness goals across 5 domains: physical, emotional, social, spiritual, intellectual. Accountability. Use wellness journals or apps. Join peer accountability circles. Schedule regular check-ins with mentors.